Okay, how many of you guys have ever went to a hospital or a clinic and the first person you saw took your blood pressure, took your temperature, took your blood, took your weight and height, and asked you what's really wrong with you? Well, usually that's a nurse. The first reason I wanted to get into this career is, well, normally people say to help people, but honestly, it's a good paying job. You're always going to have a job because everybody needs nurses, and I want to be that person that makes your worst day of your life a little bit better. Also, I have a lot of family members in the nursing career, and the way they talk seems like they like it, so I think I would like it too. Many people don't really know what nurses actually do. They don't really know how hard it is to get into the career and how hard it is to become a nurse. Well, today I'm going to fill you in on the life of a nurse, so that can probably change. First, college. There's multiple different paths you can take to become a nurse. The first one is you can become an LPN, which is a 1-year program, or you can get your associate's degree, which is a 2-year program. If you want to advance, you can do bachelor's degree, which is what the program is at UND, and that's a 4-year program. After that, you can go even further and get your master's or even a doctorate of nursing, which is master's is 4-year program and doctorate is 6 to 8 years of program. And the undergrad usually is hard for a 4-year program. There's multiple science classes, including microbiology, anatomy, physiology, chemistry, and all these courses you have to do pretty good in to get into the program. Getting into the program at UND is a very difficult task. You need almost a 4.0 in all A's in the science classes like microbiology, anatomy, physiology, chemistry, and a chemistry lab to get into the program. You only need a 2.75 to be accepted, but to actually get into the program, because it's so competitive, you almost need a 4.0. And you also need to take the TEAS test and get proficient to be able to get accepted. And then after you get in, you have to go to 2 years of nursing school, and that is between 16 to 21 credits each semester, so it's a pretty grueling program to graduate from. And then once you graduate, you're on the job, and the most important job is making acute treatment decisions for patients, performing physical examinations, which is taking temperature, taking blood pressure, looking in your ears, taking your weight, taking your height, asking you what's really wrong, provide counseling and education on medical treatments, administrate medications, they manage your IVs if you're in a hospital, observe and record patient conditions, observe patients on how to self-administrate medications. So like when you get a prescription, they will tell you how to take it, eat if you need to eat before, eat after, when to take it, what's the symptoms, what will happen to you if you don't take it, educate patients. And then another important thing for the job is it's a very stressful job. You're providing emotional support to not only a patient that you're treating, but also the family of the patient. You're trying to make their day a little bit better, even if it's probably one of the worst days of their life. And you have to answer questions, even if you might not know the answer to them. And then also dealing with doctors can be a headache, because they're usually arrogant. They think they're better than you. They have a higher pay grade and have more education, so that makes them think that they're smarter than you, and that might not always be the case. And I got that information from ANA 2018. Also, so if you get your bachelor's degree, you can always build your career and become even better in your career. An example is a nurse practitioner. A nurse practitioner follows under a doctor, but